and a very warm welcome. It is a hot one tonight, isn't it, ladies and gentlemen? It's an absolute pleasure to invite you to actually our third in our new webinar series, which we're running as part of VisioCare services. And we're running this in association with our education partners, the Veterinary Edge magazine. I'm sure many of you have heard of that fabulous magazine. But before I introduce our wonderful guest speaker, Mr. Brian Faulkner, tonight, I'd just like to firstly introduce myself. I'm Karen Faulkner, and I'm the Sales and Marketing Manager for VisioCare Services. Some of you may have heard of us, some of you may not, but we provide innovative digital tools to veterinary practice to really enhance the client communication and experience. And you can use these in the waiting room, the consult room, and they've been used to great effect with curbside consults. And also with a great client app called MyBody, and that's got some fabulous hospitalisation features. We're also the proud sponsors of the Big BRA this year, of which many of you know Brian is the co-founder. And I'm sure because of that, Brian will be familiar to many of you. So we're very grateful for that opportunity, BBRA and Brian for that opportunity. So there's a chat box and a bit of housekeeping. Please write all your questions in the chat box and we'll take them at the end. Let Brian go through his good work. So without further ado, it's an absolute pleasure and honour to welcome Mr. Brian Faulkner. Brian graduated from Edinburgh Vet School in 1995. He worked in a mixed practice before studying for an MBA at Nottingham Business School in 2001. In the last 20 years, he set up and developed 5 veterinary practices and currently leads and works as a clinician in his current practice, Aldeburgh Vets, just down the road from me, actually. Brian completed a master's in applied positive psychology, as well as general practice certificates in business, professional studies, small animal medicine, and he's an Honorary Associate Professor in the Veterinary Business at the Nottingham University Vet School. And in July 2020, he was awarded the title of Fellow of the Royal College of Veterinary Surgeons, a fantastic honour for a fantastic speaker and a fantastic veterinary surgeon. So what you might not know about Brian is he's a keen marathon runner. And in 2017, he raised £120,000 for Brook Animal Hospital by running 10 marathons in 10 consecutive days. I don't know how you did that, Brian. But what's even more amazing, in August 2020, he ran 31 marathons in 31 days from John O'Groats to Land's End. And he raised an amazing £10,000 for the charity, who I'm sure most of us all know as Street Vet. So I'm going to hand over to Brian now for what I know is going to be an interesting, informative evening on well-being and understanding self-doubt. So without further ado, I'll hand over to you, Brian.
Lovely, Karen. Thank you very much for that very kind introduction. Yep, let me just get my screen share going. And yeah, thank you very much, and welcome everyone, either those watching live or watching on demand or catch up later. This is a subject that I love teaching about, the psychology. You heard from my introduction, as well as being a veterinary clinician, I also studied, did a master's in applied positive psychology about 13 years ago. And in the last 13 years, I've been applying that psychology specifically to veterinary practice, looking at various themes, and the theme we want to look at tonight is self-doubt. This term well-being is well used. It's an umbrella term. Ultimately, it relates to various things. I'm not going to go into all the details of the definitions. We'll be here all night, but ultimately well-being is about feeling good. And there's various emotional complexes within the umbrella of well-being. Happiness, so happiness isn't a pure emotion, it's a combination of emotions. We could do a whole webinar on that alone. Confidence, which we're going to look at more specifically, and motivation. So these are 3 positive emotional complexes, if you like, that have enormous influence on our well-being. So I'm going to look at the confidence term today in particular, and also how that relates to self-doubt. The word confidence has got many definitions, and we can use it in many contexts, and people can mean slightly different things. So I'm going to define 3 aspects of confidence that are relevant to psychology and well-being. But overall, the notion of confidence from a psychological point of view means feeling purposeful despite negative but normal emotions. In other words, there's things that potentially are in our way or making us feel uncomfortable or doubtful or hesitant, but feeling purposeful. In other words, this idea that we're trying to pursue an outcome and we feel that we can still achieve it. And we'll look at the various types of outcomes that that relates to. So there's three types of confidence that I want to look at. The first type of confidence is about having a feeling about whether you know what something is, why something has happened, or whether something is going to happen. So ultimately that comes down to knowledge of a situation. We can be confident about anatomy, physiology, biochemistry, whatever system it is that we're using. So understanding how it works, what it does, maybe why, what caused A causing B, and then also that ability to predict whether something will happen. So we refer to confidence intervals, don't we, in statistics, and that's ultimately the probability with which we think an outcome will happen in a population. So that's the first element. And the first thing to be aware of that confidence is we can feel confident about whether, for example, our sports team is going to win a match, even though we're not directly involved in the event. We can make an objective observation about that. The second type of confidence relates to our personal task, if you like. We're doing it. It's something that we're involved in. So can I do it? I believe I can. I can do this task. So can I perform this operation? Do I know how to do this webinar? Do I believe I can run a marathon? And that's psychologists call self-efficacy, the belief that you will be able to do something. The third type of confidence is the one that I find that people suffer with the most, or they want the most, and that's ultimately self-esteem, or AKA self-worth. And where that relates to is that comes down to what we think other people think of us. Do people like me? Do they want me? Do they need me? This idea of our social requirement, and self-esteem is centered around that idea of what we think others think of us. So just looking at those, and to make the emphasis, the first one is very abstract or very external or objective knowledge. The second one is our personal involvement in a task. So I could be doing, for example, an operation on a dog by myself in the middle of the night, and nobody else might ever know, but it's, do I believe that I can actually achieve this outcome? And the third one is often much more in relation to a social context. What do I think people are thinking about me generally, or specifically whenever I'm doing this? So for example, you can imagine the pressure that was under the footballers when they were taking the penalties, whilst the whole world was watching. And of course, all the English fans were watching, highly expectant, and the pressure on that. And of course, we have seen some repercussions in relation to how people have had to deal with the backlash of what people have said about them. So it's a classic example of social confidence. So the next point I want to make, because this lecture, this webinar is about self-doubt, is we love these ideas of confidence. Can I do it? Do I think I'll make a valuable contribution to others such that they'll like and respect me? But often when we go about trying to pursue these things, people try and psych themselves into believing that it's going to be okay, or they can do it, when actually what they often need to deal with is the things that undermine our confidence first. And one of the things that undermines our confidence is a sense of doubt, which can then spill over or manifest as self-doubt. And that's really what I want to look at here. So that poll that we had earlier, Karen, I wanted people to give me an impression in relation to these three types of confidence. Which one do they perceive maybe they lack, or at times wish they had more of? The knowledge one, the efficacy one, the self-esteem one, or actually none of them?
Started the poll. It's going to work. I wonder if I've got a computer. Come along. Work. It's not giving me any data right now. Can people see that? Chat. Polls. Polls want to play today, do they? See? No. Not doing anything, the poll, I'm afraid, Brian.
It's just gone live. It's just gone live.
Okay. So firstly, at the minute, we've got 50% confidence in my ability to do something. That's just dropped to 33. Confidence in my knowledge, 33. And confidence about what other people think of me. Oh gosh, that's gone up to 60 now, Brian. Confidence about what other people think of me is 60%. Confidence in knowledge, 20. 16 even. Confidence in, oh wow, dropping on time. It's quite interesting. Wow, okay, I'll give it another few seconds and then we'll read it out. Okay, so 62% of people, Brian, are saying confidence about what other people think of me. 25% are saying confidence in my knowledge, and 12% are saying confidence in my ability to do something.
Okay, that's relatively standard. I know it's not a massive population, but the fact that there's a clear majority in what other people think of them is a classic, the most common thing that I see in relation to when people are wobbling, shall we say, about self-confidence. Normally they go in sequence. People feel they can acquire knowledge relatively safely. Sometimes the second most common is efficacy, but always the most common doubt is in relation to what other people think. So thank you for doing that. So let's look at a few aspects of dealing with doubt and self-doubt. So rather than a nice sunny day, we have a nice thundery day, and ultimately every day is a version of changeable weather. If we look at our emotional well-being, it can change like the weather. Things happen on a daily basis that can just upset us or knock us back, not necessarily massively. We're not talking about major traumas, but we're talking about little everyday events that can frustrate us. And when we look at everyday events, the themes connected into the things that just upset us, that were the difference between a good day or a bad day. So what I was referring to here in this slide was this suggestion that if we have a bad day, there tends to be particular themes. There's these 6 themes that often always, when we analyze what's caused our difficulties or our upset, is they're going to come into one of these 6 Ds. The first one is feeling doubtful, unsure, uncertain, just not knowing what to do about something, what decision to make. Deadlines, so time pressure is a major cause of feeling unsettled. Difficulty when we're struggling with something, a situation, a task, even a person. Feeling disappointed despite our best efforts in the outcome. Disagreement with others can certainly rattle us. And disapproval from others, the suggestion that we're in the bad books because we've done something wrong according to someone else's value set. And I could refer to these, the feeling of discomfort in relation to feeling stress. I call it dysphoria. So we can all understand and relate to the term stress, but stress is both a physiological reaction as well as a psychological one. So the physiological is the heart pumping, the sweating, all those physical aspects of stress, whereas the psychological component in our mind is I refer to as dysphoria. They are distinct, but they're combined into the stress response. Perhaps just looking at that as another metaphor, I've moved on from my weather metaphor to my snakes and ladders metaphor, and ultimately life is like a game of snakes and ladders where we constantly trying to climb up ladders and get where we want to go, and we tootle along as per the game, and we hit a snake and we come tumbling down, sometimes a little, sometimes a lot. And ultimately what confidence is this ability to remain purposeful despite these things that pull us down. And these, if you like, are the 6 snakes. So doubt, deadlines, difficulty, disappointment, disagreement, disapproval. These will push us back and make us struggle. And confidence is what gives us that ability to strive forward. If you want to get technical, what is resilience? Resilience is the ability to stop the free fall. It's that ability to stop, if we've got a snake, so we just don't keep tumbling, it's that ability to stop. But confidence is the ability to start climbing again, using this metaphor. Okay, so 2 of our major things that make us feel unsettled are doubt and deadlines, or put them another way using these words, uncertainty and urgency. And the reason why I've changed the words is because this is what I refer to as my stress equation. Stress is caused by uncertainty multiplied by urgency. So if you think almost of anything in life that caused you to feel pretty anxious or stressed and a bit freaked out in the moment, there was one or maybe both of these themes. I wasn't sure what happened, what was happening, what was going to happen, and urgency means the clock was ticking. Either there was a genuine clock, for example, with medical patients, if they're decompensating in front of us, we know we biologically only got so much time to fix them, or it can even be a perceived deadline from others, a client looking at you across the table going, well, what's the answer? And that moment of panic because they're expecting some sort of action or answer right now. So stress equals uncertainty multiplied by urgency. So when we want to manage stress in our lives, ultimately we think, okay, what can I do to try and contain the uncertainty or try and manage, prevent, or contain the sense of urgency or time pressure? And here's the thing, veterinary practice is inevitably and incessantly uncertain and urgent. That is why veterinary practice is inherently stressful. Now, it's not stress that we can't cope with. It's not like freak out stress, no one can cope with this, but it's why it keeps having this element of, just chinking away at our confidence, chinking away at our sense of well-being, because we have lots of uncertainty and urgency. And I'm going to give you an example from a clinical point of view in relation to the uncertainty. So let's say we're presented with a patient and a client in a consultation. We take a history, they tell us what's wrong with their pet. They tell us symptoms, cough, sneeze, vomit, limp, scratch, lump, diarrhea, not eating, whatever the symptom might be. Then we examine the patient. We find perhaps it's mildly dehydrated, pyrexic, sore, whatever it might be. And we therefore have our problem list, the things that are not normal that we need to resolve. Now, at this part of the consultation, feeling unsure about exactly what's causing this patient's symptoms is inevitable. Now, I wish I'd have known this 26 years ago when I graduated, and probably even about 20 years ago, 15 years ago. And when I realized this, that actually the fact that we can only tell so much information from our senses, from smelling, hearing, touching, feeling, tasting if you're mad, all our senses, we can only get so much information about what's causing a patient's symptoms. And there are no pathognomonic symptoms. In other words, there's no one single cause of cough or a sneeze or a vomit or a limp. There's always an alternative explanation. And therefore, that makes us feel unsure about exactly what's causing this symptom or this sign in this patient right now. Okay, so we have this sense of uncertainty. And this can be magnified by clients saying, so what's wrong with them then? And we can be feeling, I don't know, I'm not sure. And then the client can look at us, because we vets are meant to be able to lay hands on the patient and tell exactly what's wrong. And the client can then wonder, do we know what we're doing? And if we don't realize that what we're struggling with here is the inherent uncertainty of the situation, as opposed to some sort of self-inadequacy, we can start doubting ourselves. We can end up going, I don't know if I'm sure I know what I'm doing. And I can tell you, I see this classically kicking in around 3 years after graduation. I call it the 3-year wobble of self-doubt. I see it again and again and again. And the reason why is, in the first year, you kind of know you know nothing in the nicest way. You're happy to ask, you're happy to be told, no shame. Second year, still a little bit. Around the third year, everyone starts assuming, everyone being yourself, maybe your boss, your colleagues, even clients, you start sort of assuming, I think I would have got this by now. I am this being, I would have been able to take a history, do an exam, and be relatively confident about what's causing symptoms, and therefore relatively confident about how I go about them. But when you speak to vets, people struggle with uncertainty, sometimes their whole career. Now, the uncertainty will never go away. It'll never go away because it's a physical limitation thing. But the problems arise is when we turn this doubt, another word for uncertainty, when we turn this doubt into self-doubt. So there's a difference between saying, I don't know what's causing the symptom, or I don't know what's causing the situation, or I don't know the answer to this question, and then turning that into, because I must not be good enough. And when we make that psychological leap, I actually call that confidence cancer. The rot in our mind has set in. We've taken something that no one else could tell, and we've turned it into something personal. And that is the psychological leap. And once we do that, we're in a free fall psychologically, or at least a demise. I'm going to show you that in a slightly different way in terms of how I coach this. So here's the start of the consultation. We have high uncertainty. We don't even know what symptoms might walk in through the door. We don't certainly know what's causing them, and we don't know what we're going to do about them. So we hope at the end of the consultation that we'll feel much less uncertain. We might even feel certain if we're lucky, but a lot of the time it's actually we're just not quite as uncertain. So after we've taken the exam and the history, this is what our physical senses have told us, but this is what we would like to know. We'd love to know what's causing the symptoms. We'd love to know how best to treat them. So I call this the information gap. And it's a gap due to the limitations of the information available to us just from our physical senses. In other words, we know if we go on and look for more information, for example, through a blood sample or an image or some other laboratory test, we know we can reduce the information gap. And seeing that sort of that model of ultimately there's a gap between what we know now and what we'd like to know helps us understand that it's not our inadequacies, it's just the situation. And therefore it helps us communicate to the client what we need to do to cope with the gap. And there's two strategies really. Treat what we think it is and accept the risk. So I think your dog's got kennel cough. I haven't taken a test to prove it, but he's got all the symptoms, and typical of it. So why don't we treat him and see? So we take the risk, or we say, well, actually, I'm not sure what he's got. It could be kennel cough, could be this, could be that. So why don't we take an X-ray or take a blood sample in relation to whatever the symptom is? So we try and narrow the gap. And I often refer to that as clients. I said, you know what, we need a little bit more information here. I often refer to buying information. We need to buy a little bit more information here. And probably the best, least invasive, best value way of getting information is, for example, the blood sample, and whatever the case might be. So managing the information gap that's inevitable as opposed to being to some sort of self-inadequacy. And one of the crucial things that I find when I'm coaching, especially junior graduates, the most we need to know, and I believe it's a day one skill, we need to know the most common causes of the most common symptoms that in the species that we see. Clients have already Googled the cause of the cough, sneeze, vomit, limp, scratch, lump, diarrhea. Google's given them a million possibilities. And the reason why they pay 30, 40, maybe 50 pounds to us as vets or veterinary practice is they expect more information than what they got from free on Google. So they want to know, well, what are the probabilities of it being, for example, a cancer, an infection, a fracture, whatever the symptom might be and the cause. And that's what they want. So we need to understand the probabilities. And I think that's a day one skill. If you want more information on this, Colourful CBD do courses. So we do our non-clinical certificate in consulting. We do one in coaching consultations. And if you just want to know your differentials, oh, it's disappeared, but there's a little app that I've done. It's on both Google Play and it's also on Apple. And it's called Colourful Consultation. And it gives you a simple little filter of the 20 most common symptoms in small animal practice. You just choose the symptom, you choose the age, and it will then give you, in dog and cat, and it will give you the most common causes of those symptoms, the top three. And what you find is normally 80% of the time, the symptoms are caused by one of three things. In other words, we know 80% of coughs in middle-aged dogs are caused by, for example, infectious tracheobronchitis, or it might be early onset congestive heart failure, or it could be, rarely the foreign body, but it could be tracheal collapse in a smaller dog. So just knowing those probabilities. The second feature of the stress equation is uncertainty. In other words, urgency, the time pressure, okay? And I would say time pressure is probably the biggest stressor that we have in veterinary practice. I have to say I do get very, very frustrated at some of the systems that put us under enormous pressure. We're apparently intelligent people, but sometimes we behave not very intelligently in relation to trying to do things well in terms of the task, as well as for our own well-being. So ultimately, time pressure, either we've got just too much to do in the time available. It's not that we struggle with each task. We can do everything. We just have got too much on our list, or we take too long at doing a task in the time we have available. And the most common example of time pressure in veterinary practice is the allocation of time in consultations. For me, 10-minute consultations are obsolete. Obsolete. I mean, I wouldn't choose to buy a sofa in 10 minutes with hopefully less risk compared to actually deciding to anesthetize and operate on a sick animal. It's astonishing, really, the things that we do. I know 10 minutes is getting fewer and fewer practices are doing 10 minutes. There's still some out there. We actually now go to 20 minutes as standard. Oh my goodness, after 25 years, I've gone to 20-minute consultations. And I can tell you, My clinical outcomes, I believe, are better, and I'll show you why in a second. Certainly client satisfaction is better. And this is the big judgment, is financially we make far more money in 20 minutes than we made in 10, and certainly even 15, because that extra 5 minutes allows clients to go, okay, so I understand now about the blood or the x-ray or the operation. I think I will. Imagine you're trying to do it in 10 minutes and you're saying to someone, because you know there's someone waiting outside, and you go, well, we're going to do it. We're going to do it. Client's looking at you going, I don't think we are, Mr. Freaked Out. I'm not going to, we come across as too stressed and too pressured. So, but it's the biggest thing. You'll see vets will generally tolerate 10-minute consults, I would say, for about 2 years of their career. And then, they've got self-induced Cushing's disease with the stress they're experiencing, and they say, that's enough. I'm done. I'm not doing this anymore. I'm just going to go off to Australia and enjoy a year away. So time pressure, so that's that stress part of it, urgency is a major thing. I'm just going to show you one final thing in relation to if people think, business owners think, do you know what, I'm not sure, but really 6 consultations an hour compared to 3, surely we'll make more money if we see 6 in an hour. Well, ultimately, our financial productivity will reflect our clinical proactivity. And the best way to track that is a ratio called the diagnostic ratio. So what's that? Stick with me as I explain this. The diagnostic ratio is defined as the percentage of sick animal income that's spent on diagnostics. So whilst your head's trying to get around that, let me explain it. Income from a practice is 3 things: either preventative healthcare, so the big 5, vaccines, external parasites, internal parasites, neutering, and life stage diet, they're all preventative healthcare. So, but preventative healthcare, and then sick animal, which is consults, diagnostics, therapeutics. You may also have a small stream of merchandise. I mean pet shop products, beds and leads and toys and stuff like that. Within sick animal, so I said the diagnostic ratio was a percentage of sick animal income. So this particular portion of the total income. So when we split it, it's either consultations, so the fees for advice, diagnostics, there's only 2 types, lab and imagery, and therapeutics, anything that's trying to make a sick animal better. So medicine, surgery, anesthetics, fluid, hospitalization, anything that's trying to change the body. And the diagnostic ratio is that percentage within that sick animal income. So it makes sense that the more clinically proactive we are, i.e. the more diagnostic labs or imagery we're doing, the bigger the proportion of our sick animal income this is going to be. Whereas if we're just doing reactive, what I call jab and go medicine, this is going to be relatively small. And this is a really good proxy for clinical proactivity. So when you look at this as a scale, that diagnostic ratio is going to be somewhere between 0 and 22, 23%. And it can very quickly tell us a lot about the clinical orientation of a vet, or the whole practice here, not just talking about the individual clinicians. So I call it a reactive empirical culture if the diagnostic ratio is in single figures. So in other words, these are the guys that are kind of doing the jab and go. Okay, they're treating based on presumption, maybe a little bit more than the average. Whereas the proactive or evidential, in other words, make evidence-based diagnoses as opposed to presumptive ones, have a diagnostic ratio that's in the high teens, low 20s. So that's just an interesting way of quantifying the clinical approach. But here's the thing. If you ask any vet, where would you like to be? Well, they go, I'd like to be the proactive evidential guy up at 20%. But I have never seen consistently a practice that's able to achieve 20% diagnostic ratio whenever they've only have 10 minutes of consultation. In fact, there is a very high correlation between the diagnostic ratio that a practice and a clinician achieves and the number of minutes of contact they have with the client and the patient in the consultation. I've seen that again and again and again. And how that relates to everything. So better clinical outcomes if we spend more time with clients so we can talk through things better. They're more satisfied because they understand things. We make far more money because we actually do far more diagnostics and therefore more, shall we say, convincing therapeutics because we know what we're treating. And actually we feel better and less stressed because of less urgency. Just finishing up quickly on the other 4 Ds of dysphoria. I know this talk was about doubt and how it relates to, self-doubt. But whilst we've got these Ds, I just thought I'd very quickly touch on them with a slide each. So difficulty, ultimately, difficulty is about something that's difficult to either understand, accomplish, or deal with here. So that's something that's difficult. Now, I know that sounds like common sense. Yes, Brian, we understand the concept of difficulty, but there's two responses to difficulty. There's helplessness, where I can't do it, I'm going to give up, I just can't do it, it's too beyond me. Or there's mastery. In other words, I think I can do this, and this comes down to this self-efficacy idea. Okay, where does mastery come from? It's a process of instruction, practice, getting feedback, either from others or from your performance, and repeat, and then getting further instruction. It's just a cycle of practice, do it, test it, repeat, do it, test it, repeat. To be proficient at anything, in the world, we know we need practice again, again, again. Now, of course, the pursuit of mastery or the achievement of it is not always inherently enjoyable. If anybody's ever tried to learn, for example, even a language or a musical instrument or a sport, perhaps, there's definitely lots of frustration that can come with that. But of course, breaking through that. And we're going to talk about why some people give up and sort of say, oh, well, it fell by the wayside, whilst others persevere through that pain barrier. Here's a couple of pictures, and I'm sorry they're out of focus. It's just the best I could get in relation to the study. And the pictures on the left of each pair were, these were folk who were asked to draw a self-portrait. And all of them said, well, you know what, I'm not really an artist. I'm not very good at drawing. It's not me. But they said, well, come on, let's do your best, draw a self-portrait. And that's what they did on the left. The picture on the right is what they drew, their own self-portrait, after 5 hours of instruction in art. So they were all astonished at how much progress they had made within 5 hours. Okay, so they got instruction from someone who knew how to do self-portraits using pencil drawing, and they understood some of the practices and principles. Now, I'm such a terrible artist, I would have drawn a stick man. I would have been that person on the left. Maybe my stick man after 5 hours might have had a hat on or something like that. But it's this idea that actually you can come a long way with the right coaching, much further than you sometimes think you're ever going to be able to do. Disappointment, of course, is, we understand it, it's dejection or deflation resulting from unfulfilled hope or expectation. It just didn't happen, whatever it was that we're going to be. Now, that happens. Life's full of disappointments. Things don't always go as hoped for or planned or even expected. But it's our reaction to disappointment that ultimately determines our well-being. One of the most common, of course, is blame. Now, we can either blame ourselves or blame others. Or I'm not saying that every single time we have disappointment, we go automatically to blame, but you will find that certain mindsets will tend to blame themselves a lot. And we as vets tend to assume a lot of responsibility, for the fact that we were the last person that touched it, so therefore it must have been something to do with us. Now, when you analyze how people blame themselves or blame others, there's two styles in which they do it. The first is referred to as behavioral blame, and the second one is characterological blame. And the difference between them is behavioral blame describes what happened or didn't happen in relation to the behavior or the process. I did X or I did not do X. Characterological describes in relation to the trait or the person involved. So, oh, he's not very good, he's useless, he's pathetic, or whatever it might be. And we're going to see in a moment how that use of language and even that mindset, and we'll come back to the very specific use of language there, is how ultimately that affects one's ability to bounce back from disappointment as well as coach others. So stick with that in a moment. So those two middle ones, difficulty and disappointment, they center much more on that confidence that we referred to earlier in the form of self-efficacy. Can I do it? Okay. And we'll see again some of the mindsets that actually increase the probabilities of whether we develop self-efficacy or not. And then the last two, disagreement and disapproval. Now, these are probably the most potent weapons of dysphoria. Feelings that we disagree with others, or they disagree with us, or they disapprove of us, really hit the spot. That's the best way to make someone feel upset. And one of the reasons why is because we are hardwired to avoid rejection and ridicule. As a species, we are biologically hardwired to not get ejected or excluded from our group. And this goes all the way back to the fact that when we were evolving on the plains of Africa and East Africa, we were not the top carnivore. And if we were isolated and alone, we were vulnerable physically. So human beings evolved as a social species, the same way as sheep did, the same way as wildebeest did. In other words, there was a security in numbers. We realized we were better off if we worked together. So if I'm sleeping and you're watching, my chances of survival are increased. If we hunt food together, we're probably going to get more food than we could do as individuals added together. The synergistic effect of working. So of course we call this teamwork. But this is biologically hardwired. So we worry if we feel in any way that we're being nudged out of a group. It's why loneliness or relationship breakups or ridicule or rejection is so painful, because it's our hardwire going danger, danger. So therefore we're very sensitive to disagreement and certainly disapproval, because disapproval can be the forerunner of rejection or exclusion. So this guy here is Professor John Gottman, and he is a psychologist in Seattle, and he has been studying for the last 25 years why personal relationships break up. He wanted to see the themes of why, was there particular themes or reasons as to why people in their personal relationships broke up. And when he analyzed many of them in what he called his love lab in Seattle, he found that what he described as 4 horsemen of the apocalypse. If these 4 themes were present during a disagreement, it didn't bode well. In fact, what he did in one of his experiments in 1993, I think it was, is he took couples and he asked them to discuss a difference of opinion they held about something, and he observed them. And he was able, with 94% accuracy, able to predict whether they would be divorced in 15 years' time after 1 hour. He was 80% accurate after 15 minutes. And it wasn't to do with how much they shouted and roared, because it was quiet disagreement versus violent disagreement almost. But what he found was, if they had these 4 themes, if they criticized each other, or one of them at least criticized, contempt, and so contempt is a feeling of almost moral or social disgust. Contempt is, you're beneath me, you're disgusting, or you're nothing. So it's a form of, it's an extremely pernicious form of disrespect. Defensiveness, in other words, always feeling that one had to defend themselves as opposed to trying to understand the other aspects of the story. And what he called stonewalling, or we would just call simply ignoring. So the person that texts you and you'll say, oh, I'll just teach them a lesson, I won't reply to them for 2 days. It's that sort of, you're playing a game. And he found that if ultimately these themes were present, that they didn't bode well for a relationship. In fact, the biggest predictor was contempt. And the body language that is classic contempt is eye rolling. So rolling eyes, if you've got a teenager or you've ever seen a teenager in action, it's that sort of contemptuous, oh, you don't understand, it's so unfair, I'm not listening, you know, you're rubbish, you're stupid, that sort of behavior. So ultimately it's pushing away in the relationship. The other one that I've added, although Gottman didn't, was a sense of manipulation and control. So actually trying to dominate or control someone's behavior doesn't bode well for the long-term health of a relationship. Now, these actually, of course, were done for personal marital relationships, but the principles still hold for any relationship. So, and the relationships, of course, can be colleague relationships, or they can be colleague-client relationships. So if we see any of these signs, it ultimately things that we need to diffuse, and we have to be careful that we don't exhibit them as well. So this is where this sense of disagreement and disapproval, to be able to resist this, we need that sense of confidence in the form of self-esteem, self-worth, because the best way for someone to really undermine our confidence in ourselves is to feel that they're ridiculing or rejecting us, and that'll make us wobble. And I'm sure every single one of us have experienced that at times in our life. So how do we build that sense of confidence that allows us actually to say, despite the inevitable disagreements and the inevitable disapprovals, how do we actually build a confidence so we can maintain our sense of self-worth, which we'll look at. But before we go and look at better, more constructive, productive ways of dealing with this, I want to look at a couple of what I call rejection and ridicule avoidance strategies. Because we're so terrified that others might not like us, or they might disagree with us, or disapprove us, or reject us, or kick it out, it's a natural human reaction to say, okay, what if they think I'm not good enough? What can I do to defend myself? And there's a couple of classic but counterproductive strategies. And the first one's called perfectionism. So I'll emphasize in a moment. And the second one is called ego or narcissism. And whilst these, we may think that they're very, very different on the outside, what we would call a perfectionist and an ego narcissist, they're actually underwritten by the same psychological DNA, if you like. They both got the same worry. The third one is pragmatism. So what's the worry of the first two? They're both obsessed about trying to make the others, the world, think that they're good enough. That's their worry. They're wobbling because they're worried that, in the sense that they're inadequate. But perfectionism and ego narcissism are not personality types, they're strategies. And a strategy, of course, is always something to try and achieve an outcome. And the outcome they want is for people to think that they're good enough. They just go about it in different ways, and we'll look at them in a wee bit more detail in a couple of slides. Whereas pragmatists are much more, okay, I have my vulnerabilities, but you know what? I think if I contribute to my group or my tribe, if you like, I'll be okay. I make a contribution. It doesn't mean that no one else could potentially make the same contribution. I'm not irreplaceable, but you know what? It's my job to do this, fulfill this role. And if I do that well and make sure that everyone is okay, and that, okay, I do well, but everyone else does well, I'll be okay. Sometimes, not always. The good guy can sometimes get evicted, but generally, as a population, if we're seen to be a good contributor, we do okay. So let's have a look at perfectionism, some quick features of perfectionism. So it's so common in life, and particularly amongst high achievers, so therefore rife in our profession. And the perfectionist believes that their imperfections, their flaws, or their mistakes are ultimately revealing or leaking inadequacy. And they worry that if they do things wrong or make mistakes, ultimately it's revealing some sort of inherent flaw. And if that flaw, people sort of think, okay, well, actually, she's not so good after all, or he's not so perfect after all, that therefore potentially makes them vulnerable of rejection or ridicule. So they believe, okay, well, if I don't make any mistakes or leak any inadequacies, I'll be okay. All right, so I'll do everything perfectly, and I'll be all right. I'll avoid ridicule and rejection or any harm to reputation that could make me vulnerable socially or in the group. Okay, so that's their way of trying to maintain their self-esteem in the eyes of others. So they usually take any form of failure, especially if it's public, hard, and they usually blame themselves because they think that actually it's some sort of inherent weakness. And we'll see why in a moment. So looking at perfectionism in terms of cause effect and what they do about it, their cause is they believe they're built a certain way. So I am. Do you remember earlier I referred to characterological self-blame? The nature of describing what you are as opposed to behavioral self-blame was describing what you did. Whereas perfectionists will lean towards characterological self-blame. They'll say, I'm not great, or whatever, it's just the way I am, so I have to cope or compensate for that. And because they believe they're fixed, either their traits or their nature is what it is, they're never really going to be able to change or get brilliant at it. It's not about mastering it, it's just about making, putting on the best show that we can. So they therefore believe we're pretty fixed in our way. I just don't have what it takes, but actually I'm going to put on the best show. They worry that any inadequacies will make them look inadequate, and therefore they'll worry that other people will think that they're out of their depth, and therefore they might get sacked or someone might leave them, and that's their worry. That's what perfectionism is. It's described as a shame-based fear of never feeling good enough. Shame-based, and shame is public. So I know that you know I'm not good enough. That's what shame is. So shame, of course, can be two ways. It could be moral shame. You know that I did a bad thing, or it can be competence shame. Oh, you know that I missed the penalty, for example. So how do perfectionists cope with this? What did they do? Well, their default strategy is to avoid certain tasks that avoid risk. Why would I put myself in anything that avoids risk? I call it bitch spay-ophobia in our veterinary world. There's plenty of people who just will not spay because just terrified of the risk that comes with that. They got it in their head, and other things as well. So the idea is avoid. However, if they have to do it, often they do it in a way that's obsessive. So obsessive means investing more time than really is required to be effective. Okay, so we know obsessive compulsive disorders. It's when people, lock the doors 10 times and it's not productive. It's just a way of trying to reassure themselves. I'm not talking to that degree of obsession, but I am talking about doing the operation in 2 hours that really could have equally been done in half an hour. And when perfectionists, because they obsess and they spend longer and everything has to be to just so, is they'll have to work longer hours. And they'll also feel, because they perceive themselves as a burden, perhaps, they think, well, I need to compensate somehow. I need to do more because I'm maybe not carrying my weight if I'm not doing the operations I think I should be doing, or I'm maybe being a burden to the team. So what they'll do is they'll become a holic of something. They'll become a workaholic. They'll work, a perfectionist won't leave on their half day. A perfectionist will still be there at 9 o'clock at night. And if you're a manager and you're a perfectionist, you won't delegate. Why not? Because you're worried that someone else will ruin your reputation, and you'll micromanage them if you do, and also you'll not go home. You'd rather do the work yourself and stay late to at least be in control of it. So let's compare that to narcissism. Narcissists or narcissistic strategy, they believe, well, okay, it's a lack of power and control that ultimately puts me at risk of rejection and ridicule by those that are in power and control. If you get to call the shots by being the power player, well, really, that's who I want to be, said President Trump. So they'll compensate for weakness by publicizing success or superiority elsewhere, or they will actually undermine anyone who tries to undermine their reputation or questions their ability. They'll get rid of them, they'll undermine, they'll try and humiliate them. So narcissism, I'm sure you understand the fable of Narcissus, where it came from this idea of self-love, but as a strategy to protect our self-esteem, it's all about trying to control the image and the PR. So what do? Well, they've got the same beliefs in cause. They believe that they're made a certain way, but they're terrified about looking bad. That's the worst thing for a narcissist, is someone else is making me look bad, and therefore it could make them look out of their depth, and therefore socially can end up badly. But rather than obsess or avoid, what they tend to do is attack socially. They'll shame others, they'll blame them, they'll criticize them publicly, and therefore they'll attack or fire them quickly if they in any way damage their reputation. But in case people just don't quite get how amazing they are, they'll boast about their achievements just to make sure, okay? So I saw a quote which was wonderful this week in relation to social media. I mean, if you want to find a narcissist, go to Facebook. I'm not saying everyone on Facebook is a narcissist, but certainly social media lends themselves to narcissism very well. And I think the quote was something like, if I can remember it properly off the top of my head, it was, what is the correct answer to every social media post? Maybe it was a bit of a generalization, but it said every social media post, it was, I endorse who you are. Ultimately, they said so much social media posting is a cry for validation. And narcissists use that form very, very well. So they're the counterproductive strategies. They're actually reasonably high achieving, shall we say. We all know the narcissist and the perfectionist, because of the drive that they have to try and be socially accepted. Their achievements are phenomenal, but it's maybe not always the most sustainable or maybe the socially acceptable. Whereas pragmatism is the alternative approach, alternative mindset. And they know that life is incessantly and inevitably uncertain. And we can only control so much of our life. But we are generally better off if we stick and work together to satisfy each other's needs and wants. Okay? Generally, if we work as a team, we'll be better off. It doesn't mean there won't be cracks or bad days, but actually as a strategy, it works better. Setbacks and mistakes are individually frustrating, but they're also valuable learning opportunities. My first boss used to say, well, let's never waste a good cock-up. That's what he used to say, you know, whenever we had the trouble in practice, certainly during my early graduate years, and I still say it to myself 26 years later. What's the cause and effect and do of narcissism? Well, if we're struggling on something, the pragmatist will explain it with, I'm working on a task beyond my current skill level. Now, when you compare that to what narcissists and perfectionists say, is I am not good enough. The belief that I've maxed out on my ability. Whereas pragmatists are much more, well, I'm just working at a level that's just beyond me right now. I haven't mastered this yet. So yet is a very optimistic word. The ability to implies that we can get there, but we're just not there yet. And rather than being something wrong with themselves, they'll think there's something wrong with the process, the technique, or even the effort that they're putting in, what they can do to change. They understand that self-worth comes from a contribution socially, and they understand that the ability to make a contribution comes from mastery. So self-esteem comes from self-efficacy. And they also understand that when they're wobbling, that other people will be feeling unsure about them. There will be doubt in others. So they have to hold their nerve and realize that that's the way it is. Whereas perfectionists and ego narcissists try and paper over those cracks. When they struggle with something, they go back to basics. So if we're struggling with surgery, we go back to Halstead's principles. If we're struggling with a process, we go back to the basic skills and we get it back, you know, if you like, we fall off our horse and we go back on again and we think of the skill level that we learned from level 1, level 2, level 3, up until the level we were struggling with. Skills are acquirable, they're not genetic. You know, God doesn't hand out bitch bay genes. You know, we've mapped the human genome. We haven't found them yet. So these are learned skills. And these strategies are also learned as well. We're not born narcissistic, perfectionist, or pragmatist. We haven't found those genes in the human genome. They're strategies we acquire socially, even often without realizing it. And here's the thing. We don't use the same strategy all the time. It's entirely possible, and I'll see myself doing this, and I'm sure you admit as well, is that sometimes you're perfectionist in orientation, other times you might be a bit narcissistic, and then other times hopefully very pragmatist. So it's about the balance of these three strategies. And when pragmatists are studying, they don't want to don't help me, because if you help me, then that, you know, proves I don't know it. And you'll find perfectionists and narcissists won't accept help. They don't want help. Whereas a pragmatist goes, yeah, just help me, make me get this better. Coach me, please. Okay. So I want to take a little one of the polls now, and if we have them still there, Karen, because I think the first one I wanted to ask was in relation to, could you just remind me of the sequence, please?
How often do you see the perfection?
So you just broke up a little bit there, but I think the question...
So Brian, the next one I have is, which of these strategies resonates most with you?
Yeah, I think that was the one I wanted, yeah.
Yeah.
So which one resonates most with you? In other words, do you recognize them in yourself? Do you see them? Maybe, I mean, no one ever thinks they're narcissistic in strategy. It's by definition, you don't see your own blind spots.
So at the minute, we've 100% on perfectionism.
Well, that doesn't surprise me in our profession. So, and that's pretty. So let's have a little look in relation to. I think I broke them down. What was the next poll?
So just to tell you, that turns out 40% pragmatism and 60% perfection.
Okay, fine. So the majority being pragmatist. And don't forget that it's not black or white. You're not a pure perfectionist, even if you think you are. Is that you will have times, of course, be very pragmatic, and they're the bits that you just consider yourself being normal. Can we move on to the next poll when you're ready, Karen?
Next poll is live now.
And just remind me what it is to make sure that we're in the...
How often do you see the perfectionist strategy in the vet profession?
Okay.
Yes.
And again, you're breaking up, Karen, but just to hear what the results are.
So I'm here with you. We're just jumping between, Brian. So we're looking 75% at, I know a lot of people in the vet profession who thinks, feels, behaves like that at times. We're jumping around now. 14% across both the other two. So I know some people in the vet profession who thinks, feels, behaves like this at times, and everyone in the vet profession who thinks, feels, behaves like that at times, equally at 14%.
Well, okay, everyone. Okay. Well, in other words, the leaning was towards the fact that it seems to be a pretty common strategy, or what we would call a trait. I think a trait implies that it's fixed. It's not fixed. It's a choice. Let's have a look at the ego narcissistic one, please.
Bear with me, just bring it live for you. Oh. Okay, viewers, that's now live for you to vote.
So you've got, how often do you see the narcissistic strategy in the vet profession? At the moment, it's looking at as 100%. I know some people.
Yeah. And that's reasonable. I don't think we're all, and I don't think there's none. But I think we're going to find, yeah, you're going to find that. It's really interesting that when I started doing this, the perfectionist strategy was something that people identified immediately. The narcissistic one was one that people seemed more surprised about. They were kind of, oh yeah, actually, I do know someone like that. That sort of idea of bit of a bully, perhaps, bit of a dominant, bit of a show off. What's the final numbers there, Karen?
88%, I know some, and
yeah.
then I know a lot.
Okay, and let's do the final one with a pragmatist.
Okay, bear with me. It's on its way. Okay, vote away, guys. That's now live.
Now.
Okay, with 50. Oh, that's big jumping around on this one. Okay, looks like we're going to end on 28% for I know some people, 28% for everyone in the vet profession, and we're jumping around again. 37% I know a lot of people, and we've got 12% I don't know anyone.
So
okay.
The highest,
okay.
I know a lot of people at 37.
Okay, and of course there's a lot of pragmatism within veterinary, because you have to be physically practical and solve issues, you know, based on a lot of problem solving on the moment. But it's interesting that it's not a strong sweep of saying, oh, pretty much everybody. So my point of trying to do those little surveys was looking at the spread. And as I said earlier, the same individual can adopt all three strategies within the same hour, certainly the same day. Some people never do narcissism, some people never perfectionist. You know, but it's not uncommon to spread them up. Okay, so to finish, in the last 5 or 10 minutes, I know we went a wee bit over with the IT glitches, so bear with me. Hopefully you're okay for time. Why do people adopt these strategies? That's the million-dollar question. If you recognize the profile, well, that's only explanatory. It doesn't really help us change or predict. So this comes down to this concept of self-theories. Okay, theories about how we are, human nature. So we are built up of beliefs, okay? I call it our psychological DNA. We understand we've got real DNA that codes for external physical features like hair color, eye color, those sort of things. But we're also will show external manifestations of behavior related to our internal programming, and they're called beliefs, what we believe to be true, good, and right. And we have some beliefs that undermine our resilience or our confidence. We actually believe things that, even though we believe them, they're not good for us. They actually make us more vulnerable and wobbly. And there's alternative beliefs that we can actually build our resilience. And I call this my confidence chromosome model. So of course we would love to have the nice productive one, but sometimes inside our head, we get a belief that actually blocks the good belief from being in, okay? So the word confidence very neatly has 10 letters. And I talk about 10 theories in my Vet Whisperer program, which is available free of charge on Colourful CPD. I'm not going to go through all 10. I'm just going to go through a few of them, just to the ones that make the most difference. So the O locus is relating to the concept of optimism. And the negative belief here is that when bad outcomes or stuff happens, or stress or difficulty in our life happens, the negative belief, what we would call pessimism, sort of believes it's going to affect everything in my life and forever. It very quickly catastrophizes and generalizes. Oh, this is going to be terrible. It's never going to be any better. Whereas the more optimistic belief will keep perspective. It isn't necessarily going to be like this forever. Now note, what it didn't say was, oh, I know this bad thing is going to be temporary. That can be delusion, okay? But what they do is they question the inevitability of the fact that it's going to be bad forever. So let me just show you this in relation to some theory. This was developed by Martin Seligman, and he referred to explanatory styles. He realized when he was working with depressed people in the 60s and 70s, he realized that people who were more vulnerable to depression and remained in depression for longer explained their troubles in a certain way. But when he compared them to people who were more resilient, he found that there was different explanation styles. So the reason why things happen, bad things happen, and resilient people describe them in not necessarily permanent ways. Well, you know, things can get better, okay? And they kept it focused. Well, it's just this one thing in my life. Everything else is okay, but actually maybe this one thing at work is, you know, it's a bit of an annoyance, but actually my life's not a write-off. And if they were involved in it, they would describe it in behavioral terms, as like we referred to earlier. It's what I did or what I didn't do, or maybe what that person did or what they didn't do. Whereas when you compare that with people who slid into helplessness, which was the slippery slope into hopelessness, i.e. not belief in a good future, which is a gateway to depression, is Seligman found that they tended to generalize quickly. Always and forever language. Oh, it's never going to be any better. It's now, this is the way it is. And they kind of giving up. Pervasive. Oh yeah, I know it's just my work, but that totally affects everything in my life. I can't concentrate. You know, their whole life goes on hold when there's one problem, as opposed to being able to box it off. And it's, well, this is just the way I am. I'm just not very good. I'm inadequate, or whatever it is. And he found that when they combined those themes, they ended up with a more helpless explanatory style, whereas the opposite were much more resilient. And these were learned as opposed to genetic. So his point was that optimists learn, i.e. they acquire these beliefs, just like we acquire genes from our genome type thing, but actually in psychology of beliefs, we acquire them from our culture or from our bigger influences. We acquire beliefs, often from parents and teachers and, you know, people when we're younger. But optimists learn to dispute the inevitability of a bad outcome or the permanence of a bad outcome. They say the question, well, you never know, maybe, okay, maybe. If you look at any Tom Hanks movie, there'll be lots of themes in relation to how he questions, you know, the inevitability of things. And that's a trait. And they always said the most optimistic American presidential candidate was the one that has won the last something, I don't know, the last 20 or 24, to the point that it's now ridiculous. It's all manufactured optimism. But optimism was a bigger predictor of success. People wanted to follow optimists as opposed to people going, oh, it's going to be terrible. Language that we will see, that I'll hear, yesterday's fill in the blank, spay. I was here, yesterday's spay was the worst experience of my life and I never want to do one again. So very extreme language, the worst experience of your life. God, the dog didn't even die. You've had a pretty good life. I never want to do one again. Permanency, never. Okay, so these sort of extreme terms. And actually, these are not meant to be literal explanations. What they are ultimately calls for help, cries for help. Okay. And when you see this language, this is a way of actually saying, please, I'm wobbling, please help me. Okay, so last 5 minutes. The N locus is in relation to the nature of our beliefs about our abilities. And this is some of the most powerful psychology I have learned in my life. I've used this on myself and my kids, and we talk about it regularly in our family. And this is really powerful, okay? If you've got kids, certainly less than 10, you will kind of go, I need to know more about this stuff. The negative belief is that I believe that my talents, or a person's talent and ability, is fixed. It's just the way you are. God handed out the tennis genes, the football genes, the music, the singing, the drawing, whatever talent domain you're talking about. God handed out the genes, that's what you get. Whereas the more positive belief is that I may have a certain degree of aptitude and ability or talent right now, but you know what? They're not fixed. They can improve. Doesn't mean that I'm ever going to be Wimbledon champion, but I can get better with effort, strategy, and technique. So of course we want this sort of more positive idea that we can grow. And that might seem on face of it very common sense, but these beliefs are so subtly held that they affect many thought processes without you ever realizing. And the champion of this work is this lady here, Professor Carol Dweck from San Francisco, Berkeley University. And she was asking the question because she was one of those child prodigies. She was a spelling bee champion, well, right up until the final, but she always pulled a sickie because she was terrified of not winning the final. And she wondered, why do I do that? People keep telling me I'm amazing, but I don't feel amazing. So she made it her life's work to try and work out, why do we wobble whenever we apparently have got the goods? So she looked at external talent scores. How good are they at predicting performance? So something like an IQ. Really, how good is IQ at telling how intelligent you are? And therefore, if intelligence is the ability to adapt in the face of challenge, surely intelligent people would be able to work out the problem, okay? So one of the experiments she did was she put a bunch of students through an IQ test just to find out what it is externally measured. And then she gave them a comprehension test. The subject matter happened to be the psychology of imitation, not because it mattered, the subject, it was just something she thought this group wouldn't know much about. So as per the comprehension, read the text, answer the questions, okay? And one group, that's all they got. They were the control group. They got the comprehension text with the 7 questions afterwards. They were the control. The other group got the exact same comprehension test and the exact same questions, except for 2 sentences at the beginning. And the sentences were, how can one describe the nature of people who will most of all be that way, which will make the imitating of others happen most often? Is it the people who want to be liked because they are fine, or is it the people who want to be liked by? And this is gobbledygook. These sentences are deliberately put to freak you in the first, to make you wobble. You're going to go, what? What does that mean? What does that mean? And you're struggling with the first one, you go on and read the second one, and it's this idea of just putting a wobble and let's see how people cope now. So when she analyzed the results, in the first set, she found IQ score reliably predicted the student's performance in the comprehension test, in the non-confusing test. So if you had a high IQ score, you got a high score in the comprehension. Makes sense. Comprehensions, it's a cognitive test. But in what I'm going to call the confusing test, the one with the 2 gobbledygook sentences, she found that IQ now didn't predict it. Some people with high IQ did well, other people with high IQ didn't even finish it, they gave up, okay? So this started to kind of, okay, what's going on here? She analyzed the data further, and what she found was astonished her. She found the higher a girl's IQ, the more likely she was to wobble, give up, demonstrate helplessness during the confusion test, okay? And that was an interesting theme, she thought. She analyzed it further. Sorry, girls, it got worse. The higher a boy's IQ, the less likely he was to wobble during that confusing test, okay? So what's going on there? The higher a girl's IQ, the more likely she was to wobble when confused, whereas gender made no difference in the control test, okay? The control test without the 2 sentences. So what's going on there? And Dweck certainly recognized this in herself. She was recognized as having the highest IQ in her class or her school, but she would wobble quickly when rattled. So we'll come back to that. So when she analyzed she asked and she interviewed all the participants, and she looked and compared to those that had a wobble of self-doubt, those that gave up and doubted themselves. And ultimately, after much analysis, there was one theme that came out of their interviews. And they pretty much said, do you know what? I am the way I am. My ability is fixed. It won't change. And they found that the exposure of failure or not doing well in that confusing test, they took it really hard. And what they kept coming back to was, she said, well, do you think you'll get better at it? Well, there's no point. I just can't do comprehension. Okay. And she called that a belief that they wouldn't get any better. She called it the fixed mindset. Whereas when she interviewed those that persisted with the test, they learned and they adapted. When she interviewed those and asked, well, okay, well, why do you think that way? Their theme came through as, okay, well, okay, maybe I could have done better, but actually I think a bit more work and effort and practice and tuition, I can get better at this. And she called that mindset, that belief that they could grow, the growth mindset. Okay? So what she found was our mindset, in other words, our belief about the nature of our ability, whether it's fixed, genetically frozen, if that's the assumption, but something says that's the way you are where you are. She found that whether people felt they could grow or not had greater predictive validity in how well they did in challenges than their actual ability. If that is sometimes very subtle, and people sometimes struggle to get that in their head or understand what that means, but it's the belief about your ability as opposed to your actual ability. And we kind of understand that, you know, sometimes it's the self-belief as opposed to, we know lots of people who can do it, but they don't believe that they can. So final piece. Where does this come from? She found that there is a belief in our culture that positive feedback and praise can do no harm. And I'm identifying, as she did, this is a confidence undermining belief. I'm going to say that again. Not all positive feedback is constructive. Not all positive feedback, or this belief that positive feedback and praise can never be harmful, is a myth. Okay? Whereas the more confidence or resilience inspiring belief is that feedback needs to focus on specific things: effort, technique, strategy used. Okay? So let me finish with one final experiment. She found sometimes the feedback of negative feedback actually help build resilience, fair enough. But just as I've said, some types of praise or constructive feedback can actually make us much more vulnerable and fragile in the future. And that seems so counterproductive, or sorry, intuitive, doesn't it? How can praising my kids, myself, anyone else, ever backfire? Well, let me show you. She took a bunch of kids and she did puzzles, simple little puzzles like this. You know, we started with 3 pieces, make the 3 pieces fit into the square. And she had 2 groups. The first group, when they succeeded in the puzzle, she said to them, well done, you did it well, you're very clever. The second one, whenever they did it, she goes, well done, I like the way you went about it. Basically, you tried hard, you worked hard. I like the strategy, the effort, the technique that you used. So both positive feedback. And at the end of each round, if they did 3, she said to them, give them a choice. Do you want to stop now, or do you want to do the next level? So they went on and they did the next level. And the first group got the same praise again, the exact same praise again and again. Well done, you solved it again. You're very clever. The second group, well done, you solved it again. I like the strategy, the effort, the technique. And then she took them up to a level that she knew they wouldn't be able to do. Okay, they weren't going to be able to solve it. It was just too difficult. But she wanted to see how they responded to failure and whether the 2 forms of praise had any difference. And when she, so they had to go with the puzzle, they failed, and she said to them afterwards, okay, well, how did you get on? Okay, so some of them did it at different forms of the experiment did in different ways. The one that I liked the most was where they did it in the room by themselves, and she came out and she said to the first group, okay, how did you get on? And 40% of them lied. 40% of them said, yes, I did it. And she knew that they hadn't done it. They hadn't completed it. And then she said to them, okay, well, that's fine. Do you want to go on to the next level? And 80% in that first group that had been praised with, well done, you're very clever, said, no, I'm done. Thank you. I'm done. Even if they didn't manage to do it, they said, no, I don't want to try again. Even if they did, they said, actually, no, I'm done. Can I stop now? Okay. So when the other group that had been praised with, well done, I like the strategy, the effort, and the technique, when they failed at the difficult puzzle, and she asked them afterwards, how did they get on? 99% of them told the truth, couldn't do it. And she says, okay, do you want to have another go? And 92% of them, I believe, said, yeah, can I have another go? So when you look at those results, significant difference in persistence and telling the truth. The first group, not so much. The second group persisted, told the truth. But both had been praised, okay? And ultimately, Dweck has found if you praise people based on feedback that describes what they are or what you are, okay, and how you compare to others, well done, you are very clever, is you will instill a fixed mindset, okay? And in other words, if you give people feedback using nouns and adjectives, and that takes a bit of, oh goodness, what's a noun? A noun's a thing, an adjective that describes the thing. So you, noun, are very clever, adjective. You're instilling a belief that that's the way God made you, or that's the way genetics made you. It's just really, that's what it is. Intelligence tests are just about finding out who's got it and who hasn't, okay? Whereas if you give people feedback based on how they're doing something, all right, the strategy, the effort, technique, and you will instill the idea that they can grow their ability. And the language there is verb and adverb. So verb, a doing work. Well done, you worked, verb, hard, adverb. Okay, I like the effort you put in. So a descriptive as opposed to what you are, okay? So what does that mean in relation to the girls, the high achieving, high IQ girls who wobbled with those two confusing sentences? And this confused her. And what Dweck found was she went right back to the start. And if you look at high achieving, what she called bright girls at primary school or nursery school, as we would call it, going into primary school, and those that had been kind of groomed, if you want, by their parents to learn their numbers, learn their alphabets, start doing those sort of things, is they were perceived as very bright and intelligent, and they got a certain type of praise at school. And usually if you're a teacher trying to manage 30 kids in a classroom, even half that number, but certainly up to 30, you don't spend time on those that are doing it well. So you give them a pat on the head and you move on. But when you look at the nature of feedback and praise that they get, almost always it's nouns and adjectives. Well done, clever girl, good girl. Okay. And if you're that teacher, you're trying to control the class and help those that are maybe not doing as well. And guess who they tend to be when it's 3, 4, 5, 6, 7 years old? It's boys. And they tend to ironically get a lot more verb and adverb feedback. They tend to be, Brian, sit down, verb. Stop talking, verb. Brian, sit down, stop talking, or you can stand outside the door. What would you like? Choice, 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 process. My dogs. So they tend to get much, much more choice and process, ironically, because they misbehave. Whereas actually being perfect and actually doing everything perfectly actually propagates this notion of noun and adjective feedback. So a noun and adjective praise, it's like junk food. It hits the spot. It feels great. We all love it, but it ain't building anything. So when it comes to giving feedback, resist this temptation to praise them using nouns and adjectives. We are allowed to use nouns and adjectives to describe the challenge or the task, but not the person. So that's a complicated fracture, noun adjective. Okay, that's a difficult situation, noun adjective. Okay, so account for progress or the lack of it in terms of their strategies, their learning, the mastery of the specific strategy, learning skills or technique. Okay, I want to do one final poll and then I'm going to show you the book and you can do them. That's the book if you haven't, that's the easy read. Carol Dweck's book, really very, very interesting book. But I would love to see the poll, and it's really just to resonate in relation to the growth versus fixed mindset in the audience. Hopefully, if there's still some there.
We need Jay to do it. I can't control it.
It's live now for you guys. If you could vote away.
And just remind me of that poll questioning again, guys, because I can't see it.
Which of the mindsets resonates most with you? So I am pure fixed, I am more fixed in growth, I am more growth than fixed, and I am pure growth. We're just getting the results in now. We're sitting at 2/3 at I am more growth than fixed, and 1/3 at I'm more fixed than growth. And I think that's stabilized.
Okay. Well, and that's interesting. Now, of course, the thing is, by the way, you can be fixed in one talent domain. We might be very fixed about surgery, but quite growth about medicine. I can be very fixed about my football ability, but very growth about my tennis. And often that comes in relation to the nature of feedback from the coaches or influencers or mentors that we've had in that particular domain that can instill our ability in those. And we can end up with a fixed mindset in one zone and be quite growth in another. But you often find that people tend to have more of an orientation across the board, but not always. Okay, well, sorry for going over, but ultimately that's the summary of it. We were talking about those 3 types of confidence: knowledge, efficacy, and I can do it, verbs. contribution to society, contribution to our team ends up overall making us feel that we are we're more valued and we bring something. But that stems from the belief that we can do tasks to contribute socially. And the message is, sometimes we get stuck in our own head about what we can't do, and we start doubting ourselves, and we get locked into it. And then sometimes we play games. We become more perfectionist or narcissistic sometimes in our ability to try and persuade others that we're okay, rather than knuckling down and learning what we need to do and mastering certain techniques. And that's the message ultimately. It comes back to our psychology, and it all comes down to the language we were taught. And it almost always I get asked, can we change a growth or a fixed mindset? Yes, you can. You're reprogramming it with language, but you need to understand and change the self-talk. I hope you found that useful. I'd be delighted to take any questions if there are any.
Yeah, there's a question. Thank you, Brian. For I think the signal breakout is here in my home. So, Sarah.
I'm sorry.
I'm going to ask it for you, Brian. Yeah. So Sarah Key has asked, what is the difference between, let me just get a question, I'm sorry. What is the difference between perfectionism and imposter syndrome?
Okay, so imposter syndrome they're connected. So ultimately, imposter syndrome is this sort of feeling that I'm not entitled to do something that you're actually very capable of doing. Now, sometimes imposter syndrome, I have a little saying, if I'm feeling a bit cruel, is sometimes some people feel imposters because they are. There is this slight belief that, oh, I feel a little bit out of my depth. Oh, well, you've got imposter syndrome, just you're fine, you deserve to, you're entitled to. You go, actually, no, sometimes if you're not good enough at something, stop pretending that you are. Learn it, master it, get better at it, as opposed to trying to psych ourselves into believing it. But what genuine imposter syndrome means is you're entirely able to do something and you're entitled to do something, but actually we have this belief that we don't have the right or the capability of doing it. And often it manifests as perfectionism. So we avoid things as opposed to doing them, or we obsess on them. Imposter syndrome, the term was invented in the 80s. It was almost exclusively referred to for women in management, where they felt that, to be a proper manager, you had to be male and brusque and aggressive. And actually what we've realized is a lot of people feel imposter syndrome at their life in many domains. But it comes down to entitlement as much as ability.
Okay. Thanks, Brian. Just some comments on the rest of it. A lot of people saying that Jeff said long consults are definitely the future. And Sarah said, I hope COVID has shown practices that having longer consults is beneficial, and keep them rather than reducing them back due to labour shortages. So, positive comments on that element of it at the start. Yeah,
definitely. I just hope that we genuinely hang on to the longer consult, because we've realised we're doing a better job.
One last thing, just a comment, a very nice comment from Sarah. I agree, imposter syndrome is a normal response, that you're not skilled or knowledgeable to a task at hand. Nikki's just dropped in a last minute question. How can we break these habits in our vet practice?
These habits referring to...
I think she's talking about the three.
Okay. Well, ultimately realize that they're strategies, so therefore we have to come back to the cause. It's a bit like, why do we stop a dog from scratching? We'll work out why it's scratching. It's either going to be parasites, allergies, infection. So therefore, it's going to be either fixed or growth mindset. How do we deal with that? We deal with it through the use of language. Because what we often do is we'll go to people and say, no, you're amazing. You're phenomenal. We'll comfort and praise people using nouns and adjectives because they're efficient, but they're not effective. So actually, sometimes it's about questioning and saying things like, okay, come on. Sometimes with a narcissist, what you want to do is probably the best response to somebody saying something really narcissistic and a bit whatever is just say, okay, I hope you feel better soon. That's probably that sounds sarcastic, but ultimately that's actually what you should say to them. I hope you feel better soon. I know that can sound a bit smart-assy in the moment, but recognize that someone in that mood is probably trying too hard to tell you how amazing they are, and sometimes calling them on it and just saying, I don't know if you notice this. I don't know if you notice this, but you're constantly telling us how amazing you are. I think the only person who doesn't seem to realize that is you.
Brilliant.
You know, yeah.
Well, Brian, thank you. Karen's having trouble talking, so she's giving you a virtual round of applause. So I'll just step in and say thank you so much, Brian Faulkner. That was an incredible presentation. Sorry about all the technical glitches. Nothing we could do about the atmosphere and what it does to signals, but fingers crossed we won't have the same problems again. But Brian, thank you so much. That was really helpful. I have shared, guys, in the chat room is Colourful CPD's website address. So if you want to go and have a look, register yourself on there. I have put that into the chat box, but we will follow up this webinar with an email. We'll put all of Brian's contact details in there as well with regards to Colourful CPD. So that'll be in there. Brian, again, thank you so much from all of us at VisioCare. There is an offer on the screen for you viewers. If you want to win yourself a TV for practice, click on the link, have a little look at our newsletter that's been sent out, and you can sign up for our newsletter on the VisioCare website as visiocareservices.co.uk. Right, it's 8:30. I think everyone deserves a beer and a wine. Whatever you're going to do, enjoy your evenings, and we'll see you soon. Take care.
Thank you, everybody. Thanks, Karen. Thank you, Jay.
Bye.